to Live with Hillsdale Hospital. Today is Monday, August 26th, and we're here to keep all of you, our patients, families, neighbors, and friends in the know and up to date on the latest health news in our community. I'm Rachel Lott, Chief Communications Officer, and I'm joined as always by
J.J. Hodgshire, President, Chief Executive Officer.
And JJ, would you like to introduce our return guest?
Our return.
He's
been here twice before, maybe?
I think so.
This is your third time. Third's a charm. And even though the first was a charm, the second was brilliant. So
Right.
It is great to have you back here.
Thank you.
Ladies and gentlemen, it is my pleasure to introduce to you again Dr. Alam, a vascular surgeon right here at Hillsdale Hospital. Dr. Alam, it's always a pleasure to have you in the studio. We're going to talk a little bit today about the amazing busy practice that you have here at Hillsdale, the work that you're doing, some new procedures here at Hillsdale Hospital, integration into our community. It's been almost 2 years now, so we're excited to talk a little bit about that. So welcome back to our live event.
Thank you so much for having me again.
Great to have you.
So let's give just an overview for those watching who are not necessarily familiar with vascular care as a specialty. Give us kind of brief, what is vascular care? What types of conditions or symptoms are people coming to you for?
Unfortunately, it won't be brief, but I'll tell you.
As brief as it can be,
You know,
relatively.
majority of the vascular problems are problems of aging. As we age, we have problems with the blood vessels in our body in any vascular bed. It could be in the heart. If it happens in the heart, it's a heart attack, so the cardiologists take care of it. Everywhere else in the body, if there's a blood vessel problem, vascular surgeons are at the forefront of taking care of them. Examples would be stroke prevention in the carotid arteries. Sometimes people have what is called peripheral arterial disease in the lower extremities. That is what, if left untreated, could lead to gangrene and limb loss. So that is a big part of our practice. Another problem is venous disease in the lower extremities, primarily. When people have ulcers that don't heal for long periods of time, they end up in wound care clinic, and invariably from wound care clinic, they need to have some types of vascular procedures done to heal those wounds. One of the biggest part of our practice is aneurysms, which happen primarily in the abdominal aorta. Aneurysm is bubbling of the artery, so the artery becomes 1.5 times its normal size. When it's twice of its normal size, it is recommended that it should be treated. And we're able to treat all of those here now. So those are the major parts of vascular care. Patients should come and see a vascular doctor when the primary care doctor does all the checking, right? If the patient doesn't have a pulse, they come to see a vascular surgeon. If they have wounds, like I talked about, they they come and see vascular surgery. If they've ever had a mini stroke, or if they have a family history of stroke and they're above 60 years of age, they should come and see a vascular doctor.
Okay.
Actually, Medicare permits an ultrasound of carotid arteries in patients above 65.
And do they, is that a one and done, or is it
Like an annual
is it
thing?
an annual? Is it a triannual? Do you remember?
So, if there's no problems,
Right.
then it's a one and done.
One and done.
Okay.
If there's any problems, which is extremely common, that
Yeah.
people will have more than 50% blockage,
Yeah.
but less than 70%
Right.
blockage, so we follow them on an annual basis
Yeah.
with an ultrasound
Okay.
examination.
Yeah.
As soon as it goes above 70%, it is recommended that they should get treated.
Okay.
Got it.
You know, and I have not reviewed the data on Hillsdale. Maybe you have recently regarding the number of smokers, incidents to cancer, those type of things. But you do probably see a good number of folks who are smokers in your practice, and that tends to obviously lead to more, problems, obviously, for individuals. You want to talk a little bit about that, what you're seeing in Hillsdale?
So, like I said, vascular problems happen as we age. However, there are two conditions that make it worse: smoking and diabetes.
Right.
If you have smoking and diabetes, then I would suspect a patient to come in to see vascular surgeons in their 50s.
Okay.
Yeah.
If you have only one of those things, it's late 50s, early 60s.
Yeah.
And that is where majority of our patient population lies right now.
Yeah.
I can tell you that almost 90% of our patients are smokers. Almost 70% are diabetic,
Yeah.
and almost 60, and these are rough numbers.
Right.
And about 60% have both.
Oh, wow.
There's another problem, which is chronic kidney disease, that results in
Yes.
vascular disease happening earlier and more severe
Yeah.
in
Yeah.
patients.
Yeah.
Right.
So we have a lot of smokers in the community.
Yeah.
I don't have the exact number,
Sure.
but I can tell you that, well,
You're seeing it in your practice.
in my
Yeah,
practice, I
you're
see
seeing
a
it.
lot of
You're
Yeah.
seeing
smokers.
So, one of the things you talked about is when you look at the full continuum of care, okay? So, you're the vascular surgeon. Obviously, you're working with the wound care center. you're working with, podiatry. You're working with a vast amount of specialty care. You want to talk about that relationship and how have you felt, we at Hillsdale have come to the table for those specialty services that you've had to bring in here to help in your continuum?
Well, actually, that's a very good question, and that is part of the reason why working in Hillsdale is such a pleasure and a joy, and I'll tell you what that is. I believe Hillsdale Hospital probably has the best wound clinic in our area. The wound care center is out of this world.
It
It's
is.
very, very good. People are on top of things. As soon as they see something that needs a vascular consult, they send it to us.
Right.
It's a very good relationship that we have with the wound care team. Second, podiatry here is exemplary. It's very, very good. I see patients from podiatry all the time. Anytime they see there's a problem or if they cannot feel a pulse, they send the patients to us.
And let me interject there real quick. I don't mean to interrupt your speech here, but Dr. Bidney was the reason you're here.
Absolutely.
And so I would say podiatry was a great partner for us. Dr. Bidney brought you by one day, and then you and I had conversations, and it's a glorious relationship. But that's where it started. Dr. Bidney had actually referred some patients to you, and you're like, where the heck's Hillsdale?
Something like that, yes. So
Where the heck was it?
I did say where the heck is Hillsdale, but I had never been to Hillsdale.
Okay, that's what it was. All right.
I could point to Hillsdale on a map, but
All
I
right,
had never
good.
been.
All right.
But after Dr. Bidney and I spoke on the phone,
Yeah.
the next step was coming to Hillsdale. I
Right.
came to see her and to have lunch with her, and then she just said, let's go to the hospital.
Yeah. Yeah.
And we came, we walked through the hospital, I liked the facilities, and
Yeah.
then, one thing led to another.
Right,
So
right.
she's responsible for me
Exactly,
being here in
exactly.
Hillsdale.
And I didn't mean to interrupt your continuum, but you've got obviously wound care, you've got podiatry, other folks you've worked with.
Oh, so primary care in Hillsdale Hospital, I've spoken to almost all of the primary care providers here.
Yeah.
And they are extremely receptive to understanding what we're looking for to provide high quality vascular care.
That's right.
Right? One of the things is we have to diagnose the things early. We have to diagnose the pathology early.
Mhm.
And for that, the primary care doctors are the main players because
They're on the lookout.
it is very well documented that an elective surgery in vascular surgery has a much better outcome than an emergency surgery. Like, for example, one of our goals would be in 10 years' time, there should never be a ruptured aneurysm in Hillsdale County because we have found all of
Yeah.
them when they're
Yeah.
relatively
That'd be great.
smaller in size,
And
about
taking
5.5
care
to
of
6
them.
centimeters,
Yeah.
and we take care of them so nothing ruptures. But that is a goal. No community has zero ruptured aneurysms, but
right.
we have to decrease the numbers of ruptures.
Right.
Yeah.
Again, because elective aneurysm repair and ruptured aneurysm repair, there's a day-night difference
Right.
in the outcomes
Sure.
and the longevity on the patient's life. Again, another thing would be we should plan on finding a patient that only has pain in their leg because of lack of blood flow instead of finding patients who have gangrene. Because when gangrene sets in, you end up losing that
Yeah,
toe,
that's
sometimes that
Yeah.
extremity. So high quality vascular care is completely dependent on the primary care doctor.
Right.
It is not dependent on the hospital, it
Yeah.
is not dependent on the vascular surgeon, it's dependent on the primary care team to find these problems early,
Yes.
refer these patients at the correct time, then it's up to the vascular surgeon in the hospital to, get the ultrasound on time, get the CTA on time, get
Yeah.
the surgery done
Yeah.
quickly. So it's a continuum of care where all members of the team have to play their part.
Right.
And I think primary care here in the Hillsdale County does an amazing job of sending patients at the right time.
Right,
That's
right.
awesome.
I
That's
think
great.
it's,
It's great to hear.
I like that you explained that because for most people, and for me until probably, the last couple of years maybe, when I hear the term aneurysm, I think brain and I think fatal.
Mhm.
But you're talking about you see an aneurysm and you're determining when to operate on that, right? So can you explain for people a little more, and you talk about the abdominal aneurysm. So can you help people understand what's the difference there? Are we talking about the same aneurysm that moves? Or are we talking about a different type of aneurysm? Because I think the general public thinks aneurysm and they think brain.
Yes, and they think brain because anytime they think about a brain aneurysm, they know of someone who had a rupture of the brain aneurysm and they have passed.
Right.
So, completely different problems actually. Brain aneurysms are very small. They're generally taken care of by neurosurgeons or neurointerventional radiology. It's inside the head.
Mm-hmm.
What we're talking about is aneurysm in the peripheral arterial system, arms, legs. You can have aneurysms anywhere. The two most common blood vessels for aneurysms is the abdominal aorta,
Mm-hmm.
which is the aorta is the largest blood vessel, comes from the heart, runs all the way in the chest and the abdomen, and then divides at the belly button. So the abdominal aorta is the most common site of aneurysm, and then the second most common is the popliteal artery, which is the artery behind the knee.
Oh, okay.
So both of these are taken care of by the vascular surgeons.
Mm-hmm.
Another important place for aneurysm is in the chest.
Mm-hmm.
We fix those as well, but we fix those mostly with stent grafts. Now, if they need open surgical repair, we send them to thoracic surgery, like cardiac surgeons. They have like an open heart surgery almost.
Right.
But to answer your question, the aneurysm in the head also happens in younger people. The aneurysm in the abdominal aorta and the popliteal arteries, which is behind the knee, happens in older individuals, right? It happens because of high blood pressure, the abdominal aortic aneurysm, or smoking. And it happens almost at the area where the aorta divides, because that is the area when the blood comes down at very high speed, that is where the
It can
blood
get kind of caught up.
circles around, and that is the area of highest resistance.
Okay.
That is the area that starts ballooning up.
Mhm.
Okay, that makes sense. And are those more common in the population overall than brain aneurysms? Are brain aneurysms considered more rare?
I think abdominal aneurysms are more common than brain
Okay,
aneurysms.
it sounds like it.
Yeah.
It sounds like it. Okay.
So let's talk.
Good.
We're,
Wanna
we're
clear
talking
it.
about aneurysms.
Mhm.
Historic first in our partnership has been EVARS,
Yes.
endovascular aneurysm repair,
Mhm.
and also FEMPOP just recently, correct? Could you talk a little bit about, you brought some new services to Hillsdale Hospital for us
So
and some new procedures.
I love this question, and because it gives me an opportunity to correct you.
Okay, there it is. I love being corrected.
So,
Yes.
first of all, let me correct you.
Okay.
The first FEMPOP in this hospital was done in March of 2023.
Okay. All right.
So FEMPOP is it's called femoral to popliteal artery
Yeah.
bypass.
Yeah.
We usually do it when there's blockage of blood vessels in the thigh,
Yeah.
and we do like a plumbing job, like a bypass from above the area of blockage to below the area of
Yes.
blockage.
Okay.
We've been doing this for about a year and a half, sir.
Well, you know,
So-
I should have said, in the year and a half that you've been here.
But I'll tell you what we have started recently. Actually, the EVAR, which is the endovascular aneurysm repair or endovascular aortic repair, we started doing that in June of last year. Since that time, we've done 16 or 17 endografts.
I know.
Wow.
And the reason why I'm extremely proud to be able to do those here is because these are endovascular cases. When I first came here, I was told we have a C-arm that we've never used in vascular surgery. We do ortho cases with that.
Mhm.
But the C-arm, which is, for people who don't know, it's like a, I guess, mobile X-ray machine, right? It gives you X-ray in real time,
Yeah.
live X-ray. And we use that for endovascular cases, which means fixing a blood vessel from inside the blood vessel instead of making a big cut. The simplest way of understanding is heart stents. You know, everybody knows somebody who's had a heart stent placed, right? It is an example of an endovascular case. They go in with a wire inside the blood vessel. They're watching in real time an X-ray how the heart is beating, and where the stent is going to be placed.
Mhm.
Now, a heart stent is usually 2 to 3 millimeters in diameter, but an aneurysm graft is about 3 centimeters in diameter. So it's
Oh,
10
wow.
times the size.
Mhm.
Okay.
Right? So the way we do it is, the patient is under anesthesia. You do cut downs on the blood vessels, get to the blood vessels in the groin area, and through those we pass the wire, and then under X-ray we put the stent grafts in.
Okay.
So I think if I start explaining it more, it will get more complicated for the people listening. But simple way of understanding is the area of aneurysm, we go above it to normal artery, and we stay below it to normal artery, and the aneurysm is excluded from circulation and the blood flows through a covered stent graft.
Okay.
Does that make sense?
So you're going past it essentially, or
Yes,
around
we're
it?
going above it to normal artery.
Okay.
So, see, it's a principle of surgery. The principle of vascular surgery is you have to fix the abnormal vessel by going above it to normal artery and below it to normal artery. If you have to do surgery from normal to normal.
Mhm.
Got
Right?
it.
So that principle stays with the endovascular repair as well. But the reason why I'm proud of it is no one in this hospital had any experience of it apart from me.
Yeah.
Right?
Right.
Our anesthesia team
Right.
trained themselves, learned whatever needed to be learned.
Right.
You know, they do an amazing job with these operations. Our nursing staff, the OR and PACU nursing staff, I'm especially very proud of them.
Great
They-
people. Great.
They learned from scratch, and
And you were in here teaching them. I mean, I
He
heard
was,
you in there in
many
the,
times.
in the training center teaching
Years
the
ago,
nurses,
when he
and they're
first came.
usually cracking up. It sounds like you're a very entertaining
Oh,
trainer.
he's very entertaining. He corrects me all the time, and people love it. They laugh.
come on, don't be jealous now. Now, the thing is that I can train for, I don't know, 1, 2, 3, 5 hours, but it's up to them to take it upon themselves to
Right.
get whatever resource they can find nowadays with internet. It's so easy to find
Yes.
resources.
Yeah.
Each one of them has learned on their own time, in addition to whatever, we have told them about the operation or trained them about the operation. Same thing goes for the ICU nursing staff. They went out of their way to learn everything that they have to learn, because of which we have had an amazing program. We've done about 16 or 17 cases. I think I did the last one this last Friday. And we have like 4 or 5 more on the book that we're going to do in the next month or so. Every one of them has had 0 complication, touch wood, thank God. And it's because of the team that we have. I'll give you an example. We had a patient that was supposed to be done 3 weeks ago now. He came into the morning, and I realized that his stress test was not right. The cardiologist helped me with that. That patient was sent for a cardiac cath instead of an ER. We canceled the ER, even though his aneurysm is 8 centimeters in size. It's huge. I canceled it. I sent him to the cardiology office. He had a cardiac cath, ended up with an open heart surgery that day.
Oh wow.
So
Amazing.
all of that happened because anesthesia saw something and I saw something, and together we were
Yeah.
able to make a decision not to do this
Incredible.
operation.
Yeah.
The gentleman had an open heart surgery, he's completely recovered, and we're going to do his EVAR in the next couple of weeks, which will be about 6 weeks from his open heart surgery. So these are the type of things with team and all of us are able to rely on each other, is how the EVAR has worked so well.
Yeah.
Now, the new procedure that we did here is not the FEMPA bypass, it's the aortobifemoral bypass, which is open aortic surgery.
Okay.
Which, when I first started here, was a dream to be able to do here because everybody was like, oh, we cannot get blood. Oh, our ICU cannot take care of these patients. Oh, we don't have ICU doctors. So what we did was, let me have a drink of water. I'm getting...
Yeah, and I remember those comments very, very vividly, telling me that you will never do that here, JJ.
Yeah.
And you and I talked, and you said, absolutely, we will.
We will. And, we had a vision to be able to grow the program in the right direction. And, thank God we were able to do an aortobifemoral bypass, which is, a big open incision in the abdomen, a big incision on both groins, and we bypass the area of the aorta that is blocked off. We do it for aneurysm sometimes as well. That is the old-fashioned aneurysm
Yeah.
surgery. But we do it as a bypass when people cannot have blood flow from the aorta down into both legs. The only bypass is an aortobifemoral bypass. We did it, and the gentleman did extremely well. He was in the hospital for 5-6 days, and I've seen him in clinic since then. All his staples are out. He's living a great life. He's walking around doing all the things that he wanted to do. And the reason to do the surgery was he just had no strength in his legs, and he was a younger man. And we sat down, we talked about stenting, this, that, and we realized that the best option is to do bypass surgery on him. And, it took us about 3 hours in the operating room, and ICU did great. I was here as well on that night.
And remarkably, I want to point this out, that he stayed here, right here in our community, to make sure that patient was well cared for, continuous care, communicating with the hospitalist team, making sure the patient recovered well. I want to thank you for that.
Oh, it's my pleasure.
For staying here, you were away from your home that night, here in our community. That is dedication,
It
Rachel.
is, absolutely.
It just shows what you're willing to do for Hillsdale Hospital and our patients. And I want to say thank you,
Oh, it's my
because
pleasure.
it was a remarkable, I've talked with the family members of that particular patient, and they're extremely satisfied and happy. And it's life-changing. It is truly life-changing when someone regains mobility or endurance, or the ability to walk more. That's incredible. It's life-changing events in people's lives.
And aortobiofemoral operations, if they're done correctly, of all the vascular surgical procedures, they last the longest.
And when you say
for 20, 30 years.
That's what I was asking you, 20, 30 years.
Yeah, they last for 20, 30 years without a problem. I actually have a 90-year-old patient who had a aortobiofemoral bypass done by someone else in Chicago 40 years ago.
Is that
Wow.
right?
And it's still working.
Oh my goodness.
The gentleman doesn't do a lot now, but
Right.
his bypass is still working.
Isn't that
He still has
amazing?
flow to both his feet. So
It's amazing.
It's amazing.
That is absolutely
That's great.
incredible.
So I want to ask you about the decision to start doing some of these more complex procedures here, because as JJ mentioned, he might be told we can't do that here, and then JJ's probably looking at you going, can we do that here? And then you're like, well, why can't we? These are what we need. This is what we need to do. So what made you think, I think I want to start doing these types of procedures at Hillsdale Hospital?
I think you partly answered your own question, and I'll tell you why that is. Anytime you're looking for an answer, the first answer you find is why.
Mm-hmm.
Why are we doing what we're doing, right?
Right.
So the reason we started doing it, because, please don't take it the wrong way, Hillsdale is in the middle of nowhere.
Right?
Right.
We don't take that the wrong
That's,
way.
I mean,
That's,
hey,
that's
facts are
what we
facts.
live.
Yeah.
That's what we live.
Patients
There's
from
no interstate in
Hillsdale,
this county.
patients from Hillsdale have to travel at least 45 minutes to get anywhere,
Sure.
where they can get health care, right?
Absolutely.
Or maybe a great meal. They have to travel 45 minutes, right? Now,
Other than Olivia's Chop House. I have to
well,
tell you.
okay, that's fine. They have a good steak, I
All right.
agree.
I have to take care of the locals and Johnny T's. And, well, anyway.
Yeah.
but-
The Hunt Club is good as well.
The Hunt Club's good.
Yeah.
All right.
So in any case, when we sat down and we started discussing what we were going to do, it was actually just one meeting. JJ and I had, along with the chair of surgery at the time. And the discussion was only one. What are we looking to do? Right? Do we need another warm body at Hillsdale Hospital? No, that was not the goal.
Mm-hmm.
And I'm just going to start traveling an hour and 15 minutes from my home just for that.
Just
The
because,
reason that we wanted to do it was we wanted to provide comprehensive care within Hillsdale to the patients that live in Hillsdale.
That's right.
It's easy for one person to drive instead of everyone to
That's
drive
right.
out of here,
Yeah. Yeah.
right? So now, with that in mind, ever since we started, our goal was to be able to do complex vascular operations at Hillsdale Hospital. That had been our goal from the very beginning. From the very beginning, our goal was not to do, small vascular procedures and get out of here.
Right.
So what we did was, we slowly but surely, we have built ourselves up. I still remember the first operation I did here was cleaning an amputation, because I was concerned, how will
Yeah.
people be able to take care of
Right.
patients?
Right.
But
And we were doing high fives after that.
Oh, after
Because
that, we were so
we were.
happy.
Yeah.
We were.
that is February of 2023,
Yeah.
and since that time, we have grown slowly, but we've grown surely.
Yeah.
Right.
And we did the FEMPA bypasses. Then we started doing other vascular procedures. I've done some dialysis access procedures here. Those are simpler vascular operations. Then we started doing the EVAR surgery, right? We've done a bunch of those. Then we did the aortobiofem. But I think the patients that require the most care postoperatively is a carotid endarterectomy, right? It's carotid surgery, which is stroke prevention.
Mhm.
That I did about a month and a half, almost 2 months ago now. And that was done after we realized that, yes, we have been able to meet all our benchmarks, so to say, right? 3 months, 6 month, 9 month, 12
Yeah,
month.
yeah.
And these were not written down. These were somewhere in our minds between me and JJ. We realized that these are the benchmarks we are going to hit. And I think so far we've hit most of them,
And exceeded.
more or
And
less.
exceeded.
And our goal is that one day we'll be able to do complex, what is called hybrid operations, which means endovascular and open together. And in one OR, I think our OR people are trained enough in endovascular
Yeah.
that we can do it.
Yeah.
Our anesthesia team is phenomenal.
They
I
are.
think we can do it with them.
Great team.
So these are like 5, 6, 7 hour operations,
Yeah.
but we will be able to do them here, and that is our
Yeah.
goal. That is what we're working
Right.
towards. So, again, carotid is a very simple operation, but the patient requires a lot of care postoperatively.
Yeah.
Carotid surgery is done for stroke prevention,
Right.
and it's when you do it, you basically the patient does not have a stroke. or they're deemed safe from a stroke,
Mm.
but you have to follow them on a regular
Okay.
basis.
Right.
So I've got a follow-up question for you. So as you know, we listen, we're hearing what you're saying. A lot of work's happening in the hospital. Great team, but not everything vascular has to happen in the hospital, right?
Right.
So you have a clinic
Mhm.
here in Hillsdale,
Mhm.
and why don't you talk to us a little bit about what types of things, i.e., procedures, can you do either here or you have another clinic also outside of Hillsdale? You want to talk a little bit about that because it's not everything doesn't have to turn to a surgery at Hillsdale Hospital,
Yes.
right?
So the important thing is care for patients in Hillsdale, right? I have an office in Hillsdale. My main office is in Battle Creek.
Right.
Mhm.
So sometimes people have to come to our office for small office-based procedures that we do in our office. Right now, I do not have the capability or the office space to be able to do it in Hillsdale.
Right.
So all of those procedures are being done in Battle Creek. Patients have to travel there. You know, simple like vein procedures like we talked about, right? People who have large ulcers, I go in with a wire and we, put a catheter and we ablate the vein. These are office procedures. You don't do them in the
You don't
OR,
need to.
right? You don't.
Yeah.
I can do 8 of them in the office in one day. If I
Right.
started wasting OR time, we
Right.
won't be able to do more than
No.
3, and it will be just wastage of time.
Right.
And they're generally done with or without slight sedation.
Mhm.
I do some arterial cases as well, which is like endovascular cases with wires, balloons, and catheters. We do them in our office as well because it's just easier to do it that way
Yeah.
Mhm.
Yeah.
instead of doing it in the hospital.
All right. So been in Hillsdale now almost 2 years.
Mhm.
I remember the first time you and I had a chance to meet when Dr. Bidney did introduce us, but then afterwards, we had a few dinners together with some various folks, not only with Chief of Surgery at that time, but then later follow up with the manager of the OR. And if you remember that, the team of folks where we talked a little bit about education and making sure staff were ready. But now that you've been here almost 2 years, and I don't want to cast any type of shadows on the other communities that you were in, but what makes Hillsdale a little different in your mind, in practicing? I guess, why do you love coming to Hillsdale? It's a huge time commitment for you. It's an hour and 35-minute drive?
Oh, no, you drive very slow.
Oh.
It's an hour and 10 minutes.
Hour and 10 minutes, all right. Well, that's right, but you have cars that go faster than my moped. So it's an hour and 10 minutes, and you are coming to Hillsdale a lot now, expanding some office time, so why do you love our community?
There's there are 2 reasons. I'm sorry. One is personal. One is, I guess, work-wise. The personal reason is the people. I actually really like the people in Hillsdale, and that's what the board says, right? When you're entering Hillsdale, next to Meyer, it says Hillsdale is the people,
Right.
and I really believe that. That's my personal reason.
Yeah.
But my professional reason is, I believe, and I can be wrong, that the people of Hillsdale County have had the worst vascular care or the worst access to vascular care in the general Western Michigan, lower Western Michigan population. And I have seen that when I see all these patients coming in. There are patients who have never been seen by vascular surgery and they should have been seen 10 years ago.
Right.
Wow. Yeah.
And
They just didn't find.
either they didn't find or they
Right.
didn't pay attention or
Right.
there was not enough education, because at the bottom of everything
Right.
is what the patient understands is
Yeah.
a problem,
Yeah.
Right.
right? If there's
Right.
a patient that does farming and has a big ulcer under their leg and they feel that it happened because of poison ivy, and they
Oh,
don't
right.
understand that it could be a vascular
Underlying
problem,
issue, yeah.
and those are the educational points that I personally rely on the primary care team to make sure the patients
Correct.
understand that.
Correct.
So I think this population was most in need of vascular surgery. Also, I'm in private practice, so driving an hour and 10 minutes for me is not a big deal. It's my own time, it's my own schedule. I know what I want to do. So because of that, I chose Hillsdale after Hillsdale chose me,
Mhm.
because it seemed to me like it would be a very good, as a surgeon, there's a dime a dozen surgeons everywhere. You want to be needed, right?
Right.
That is the professional satisfaction that
Yeah.
you get from our
Right.
jobs, and I think I get it in Hillsdale.
Absolutely. And the response, I want to let you know, from patients to staff to your colleagues has been incredible.
Thank
They are equally as impressed as I am, but also ecstatic that you're here. Patients do not have to travel to other communities to have their surgical interventions. They can do it right here at Hillsdale, for those complex cases that you've talked about. I'm excited about that because transportation, Rachel, is a major concern in our
Right.
community, lack thereof. You have a local dial-a-ride that goes through the city, and that's about it.
Right.
And it's limited in the hours. They're not going to be transporting people away out of this community. So having access in our community is so critical. So I just want to thank you. Our staff, when you're done teaching, I get all kinds of comments about he was funny, he was entertaining, he was enlightening, but he was educational. And it's you're giving them, information that they've never had before to help recover the patient, take care of the patient, and ultimately change the lives of patients. So I want to thank you on behalf of Hillsdale Hospital. We have great opportunities ahead of us, Dr. Lam, great opportunities. And I'm excited what the future's going to bring.
It's easy to do cases anywhere. I think the most important factor here is quality. We have been able to have very good results with all the procedures we have done.
I agree.
I'll tell you
The
something.
outcomes have been great.
I'll tell you something else. In almost 2 years of me doing surgery here, we have not taken back a single patient back to the OR, which is a common occurrence in vascular surgery. It's not that, it's not like taking a gallbladder out. In vascular surgery, there's bleeding, there's this, there's that. So redo vascular operations are very common, but so far, thank God, we have not been had to take a single patient back to the operating room.
Absolutely, which is incredible.
Yes.
Amazing, and a testimony to the work that you're doing. So thank you.
Right. And a perfect example of, our vision at Hillsdale Hospital being to create that access to specialty care that our community
That's
has
right.
not had before,
That's right.
or maybe has not had enough of before.
Right.
And so bringing in specialists like you that you may not have a full-time practice here, but you're here enough that it creates that opportunity
Weekly.
for patients to get
Yeah.
the care that they need
Yeah.
here in Hillsdale. So we could go on and on
We
and
could.
on, but we obviously love you
Well,
having you here.
Let's talk a little bit about his practice, where he's located, because
Yes.
you are thinking about some expansion here in the future of hours and some other things. And so why don't you tell our listeners right now, how do they get a hold of you? What is the best mechanism for that? When is your office hours typically? And if you could enlighten them a little bit.
Okay. So I'm going to have to look at the phone number here because I don't remember it. Thank you. So we are in the Three Meadows building, right? And the reason why I say it like that is because I think it's a very well-known building in the area.
Yes.
It is.
So it's the Three Meadows Medical
Yeah.
Building. We are on the ground floor, and I am here every single Monday, all day. So when I say all day, my clinic starts generally from 8:30, and it runs to about 3:30, 4 o'clock,
Right.
during the day. Every single Monday I'm here. I have changed my schedule in a way where nothing can change me coming to Hillsdale on Monday. Right?
Got it.
So if anybody wants access to vascular care, the best way is to call my office and to get an appointment, and the office number is 269-979-6310. If you do not want to call, or if you forget to call, you can literally walk into the office and we will accommodate you.
Which is very nice, and I know you've done that
Yes.
numerous times.
You may have to wait,
You may?
Right.
but we will accommodate you. And every Monday I'm here. I operate in the hospital 2 Fridays a month right now, and we're working towards getting more time as more cases need to be done. And those Fridays are the first and third Friday of the month. I have had a couple of instances where patients come to see me on a Friday because they just want to be seen on a Friday. So they come to the ER, and I see them in the ER bay.
Yeah.
And we decide from there if they have to be admitted or we can see
Right.
them as an outpatient. But those are the two ways of getting to me in
Yeah,
Hillsdale.
that's great. Excellent.
And you can also go to hillsdalehospital.com/vascular and see a little more information about what we have available here, as well as the phone number and that contact information that Dr. Alam shared. So with that, do we have any questions from our live audience today?
Wow.
We do not. Okay. I think we do have a
That's
little bit of a
incredible.
game
Oh,
for
we
today,
do?
as
Oh,
we have
boy.
been doing. So we have a little spelling quiz.
Oh,
So let's get our
Not
handy
spelling.
whiteboards.
not spelling.
Dr. Alam is going to give us a word that we have to try to spell.
I think you're both going to fail, but I'm still going to give it to you.
All right.
And it's not a
Let's
word,
see.
it's a procedure.
Can I use my
Oh, it's a
board?
procedure. Okay.
No,
No.
please don't.
Okay.
Do it yourself.
All right.
Turn the iPad off. Close the iPad.
Yeah, try to spell
No cheating.
carotid endarterectomy.
Can I ask if it's 2 words or not? Maybe
Yeah,
not.
you guys have to answer it yourselves. It's like the newest, it's the oldest new procedure we've done here.
Wow, this gets real smudgy when you have to erase something. Okay. Okay. Rachel, stop talking. Just write.
Yeah, please.
You're confusing, JJ.
Yeah.
It takes me shorter to do the operation.
Okay.
I was already done.
I'm thinking and,
I was
and
already
writing,
done.
and I get to every letter, and I'm like, is it going to be this? Is this going to be
All
this?
right.
Okay.
You ready?
Yeah.
Good. Potato, Vice President Cornell. With an E.
Potato?
With an E.
Nice.
Because that's
With
how
an
he got
E.
in trouble. All right.
Dude, Rich, you got it right.
The whole thing?
Yes, and R.
Because here I was like, is that going to be an A or an O? And like, is this going to be an A or an
Sure,
E?
you gave her the word, didn't you?
No, he
I
didn't.
did
He
not.
really didn't.
I did not.
All right. Is it true? Is
I
it
do a lot
true,
of writing
Kirsten?
for a living, so maybe that's an unfair
That's what she does
advantage.
for a living.
Mm.
So.
Yeah, so on that note.
Hey, but listen, you've gotten way more points lately than I have on our game, so good for me.
No, I still like
He
potato.
That's
even
really
spelled
good.
potato incorrectly.
I know.
I love it.
It's a
It's
good
perfect.
for sure.
It's E.
All right, well
Is
that
it
was fun.
lunchtime yet? Potato sounds
I
good.
think, yeah, potato with
What's in the
carotid,
cafeteria?
yeah.
In-
Good job, Rachel.
Wait, but how do you say it again?
So carotid, that's the name of the artery, right? Carotid.
Okay. Yes.
And arterectomy.
Okay. What is the end referring to? Because the arterectomy, I'm assuming, is artery, and then
So end arterectomy means you open up the blood vessel like this, and you take all the bad stuff out of it. and
that's
you
the
close it
ectomy part, is taking stuff out.
again. Actually, end arterectomy is one word. That is what that means.
Right. Okay.
It's not broken into end and
It's
art
not like
and ectomy.
the parts are not coming together. It's just
Yeah.
that's the
Just
okay.
like end arterectomy is a procedure you do. You open up the blood vessel, take all the bad stuff out of it, and you close it.
Nice.
Nice.
Well, good for me. I'm proud of
Excellent.
myself.
Congratulations.
I'm
Thank
proud of
you.
you too.
That's great. That's great. Yeah,
Love it. All
excellent.
right. Well, with that, JJ, you want to close us out?
Me? Oh
Yeah.
my goodness. Well,
we closed our iPads. We don't know what to
Exactly.
say anymore.
well, thank you to our viewers. First of all, thank you, Dr. Lam. It is great. I know you got to get back to the office. We're going to get you there. A lot of great things that are happening in vascular today. Very excited that you joined us today to listen. If you're interested in talking with a vascular surgeon right here, Dr. Alam, in our partnership with Dr. Alam, a lot of great things are happening right here at this hospital because he uses this hospital for boarding those surgical cases. So we're very, very grateful for that relationship. And for you, our listener, thank you for your contributions. If you're looking to join a winning team, you can do it right here at Hillsdale
Yes.
Hospital. I know the numbers are becoming smaller and smaller.
Yes.
I think Stacy reported 26, maybe 27 job
Something like
openings.
that, yeah.
Check it out online, hillsdalehospital.com. We also are listed on the careers tab
Yep.
where you can see what jobs are open. Many of them are entry-level jobs that lead to great opportunities. If you want to become a nurse, you want to become a scrub tech, the list goes on and on. We'll sponsor you. This could be your place for the rest of your career. We would love to have you right here at Hillsdale Hospital. If you're looking to volunteer, another great place to do that. We are in need of volunteers. Variety of volunteer posts that we have. Folks that work in the gift shop, that deliver, that greet people. There's a tremendous amount of opportunity for you to volunteer and give back to your community. If you're looking for a way just to say thank you to a healthcare provider, healthcare industry member, please go to our Facebook, make a mention. We love to hear the stories, and so do they. If you know a healthcare provider in your community, send them a thank you card. Tell them thank you. These are very difficult times. Don't forget, we still have COVID among us. We still have the flu here. We're dealing with all of these issues. None of that's changed on our end. We're working just as aggressive and hard as we did 2 years ago. We want you to say thank you to our community. And we want to say thank you to you for using our services. Because we have been in existence for well over 100 years, is because you have trusted us to give you the care, just like vascular surgery, and all of the surgical services, and all of the primary care, and all of the specialty care that we deliver each and every day. Your use of those allow us to continue this mission. And this is truly a mission that we're engaged in right here at Hillsdale Hospital. So we're excited that you joined us today. Every Wednesday, typically, we do live.
Yes.
Today it's a little different.
As you
because
heard,
it's
Dr. Lam is
office
here on
hours.
Mondays.
That's right.
So here we are.
So I don't think we're going to do one this Wednesday.
Right.
This is this Wednesday
our one
on
for the week,
Monday.
yep.
But also, we have a national podcast, Rural Health Rising, wherever you get your podcasts. Subscribe to that because every Thursday there is and we're up to like episode, 170?
I can't even keep track.
I think like
anymore.
170.
Yeah, maybe.
It's really
We're getting up there.
incredible the number of guests
That
we've
doesn't
had.
include our mini-sodes either, which,
No.
as we all know, are actually
Probably
the mini,
well
because
over
it's just
200.
JJ and I talking, so they
Yeah.
get a little long.
Absolutely. And on WCSR every Friday, you can hear an update about Hillsdale Hospital. And then now we are
On Buzz Online on Saturdays.
on Saturday Buzz Online, so that's great. So any of those places, you can learn about the great things that are happening at your local hospital. And remember, we ask, choose Hillsdale first because it's so important for our economy, the Hillsdale economy, as well as continuing what you see here in the operations of our Hillsdale Community Hospital. So we're so excited that you joined us today. And until next time, stay safe, stay healthy, and stay Hillsdale strong when